This Medical Monday is sponsored by the George Washington University Hospital.
Well, this Medical Monday, we are learning more about emergency medicine, and joining us from the George Washington University Hospital is their Chief Medical Officer and Clinical Professor of Emergency Medicine, Dr. Bruno Petinaux. Wonderful to have you here on Good Morning Washington.
Thank you so much for having me, Ken.
So let's talk about GW in this region and what people should know about it.
Absolutely. So George Washington does provide complex medical care throughout the continuum of care within the region. We have 3 facilities here: the George Washington University Hospital, Cedar Hill Regional Medical Center, GW Health, and then the urgent care, GW Health also, which each provide different services and levels of care.
Well, since you mentioned urgent care, let's talk about that and when people should be using urgent care.
Absolutely. Think of urgent care as your primary care physician but didn't have time to see you or couldn't get in to see you as an appointment. So, cough, colds, simple rashes, maybe a sprained ankle, a urinary tract infection. Those are great reasons to be seen in urgent care, as we have the capability to do some basic x-rays and lab work, allow for a diagnosis to be made, treatment to be initiated, and then certainly referral on to any additional care that you might need.
And what if someone would need more care?
Yeah, in the same region, which is Ward 8 of the city, we're very pleased in the partnership with the city to have constructed the Cedar Hill Regional Medical Center, GW Health. And there we have a full emergency department for both adult and pediatric patients, where we're able to provide full services for patients that might need additional care.
Let's talk overall what services that your hospital offers the community.
Yeah, the George Washington University Hospital is a quaternary medical center, meaning that we provide the highest level services for adults in the region. We are a level 1 trauma center, so take care of the sickest and most injured patients. We provide stroke services also. So if somebody has a stroke, we provide all of the treatment options, including going into the brain with a catheter and vacuuming out a clot if necessary and indicated. We also are very proud to support the district in the whole blood effort, where we provide the District of Columbia Fire Department with blood products to transfuse patients should they need that in the field before they even come to the hospital. So our relationship with the city is so important in the care of everybody in the District of Columbia.
And saving lives. Thank you so much for sharing all this great information with us. Wonderful to have you here with us today. And we're going to put all the information up on the screen, how you can learn more about everything that we talked about here today on this Medical Monday.